Hello, this is Dr. Gay from First Look MRI, and this is a 26-year-old female with complaints of ankle pain for about 2.5 months. The pain wouldn't go away. She had no history of prior injury, just pain that persisted, so she decided to come in and get an MRI of her ankle. And to get oriented here, we have a sagittal view here. This is the tibia that comes down and it articulates with this bone here, the talus. This is the ankle joint, the tibia-talar joint. And back here is where she has her problem. We can see that this is too bright. This is a stir sequence, so marrow should be dark, but instead we see this foggy brightness throughout her calcaneus. And she has no history of prior injury, so this is a stress fracture. We see this pretty commonly back here. Usually the stress fractures of the calcaneus are in the back here. They involve the back superior aspects, so very classic location. And in this patient we see this subtle vertical band here and the bright signal around us. This is a stress fracture, a typical location of the calcaneus. Usually it's from overuse. They start walking a new exercise regimen or jogging and they get this. And this is their Achilles tendon that looks normal. Now this shows up better on a T1 weighted image. So this is a stir image. We see the marrow edema, but the stress fracture line is right here. Don't see that as well as we'd like, so we're going to put up a sagittal T1 weighted image. Now marrow is bright, fat is bright, all fat is bright, so the fat in the marrow is bright, and so is the subcutaneous fat. We see the calcaneus, we see the talus, we see the cuboid bone here. Now we're going to look for that fracture line, and there it is. This is a vertical non-displaced fracture line. We call it a stress fracture. And again, it usually comes to the top cortex here. And again, usually from overuse, starting a new exercise regimen or a new walking. And that's it. Thank you so much.